Okay. Okay, the event is now recording. I'm going to start off by saying hello and welcome. Thank you so much for coming to Gallaudet's SAA event, our Deaf Perspectives panel discussion. My name is Mary Stoner, and I'm a Gallaudet audiology student. So at this point, if you are not one of our panelists, I want to say hello. Wait, sorry. Let's have our SAA officers say hello. Everyone wave hello first. And now, if you are not on the panel, please turn your camera off. So tonight, I hope that we will talk about many reasons why it's so important that we think deeply and caringly about the deaf perspective and why Gallaudet University is such a special place. Again, why Gallaudet is so special to us in terms of the culture and perspectives and community and learning that takes place here. In the midst of COVID, we go to Gallaudet and we have these experiences of seeing and learning that have been so limited. You know, being here on Zoom has limited our ability to have the exposure to the deaf community. But tonight, we have people who are here to teach us more about the deaf perspective through a conversation. And we think tonight is going to be a good time. So our plan is that for the first hour, I will be asking different questions of our panelists. And then for the last 30 minutes, we will open it up to Q&A for students. So during that question and answer period, if you want to ask a question, if you want to use American Sign Language, that would be awesome. If you need to use spoken English, that is also perfectly all right. If you are signing American Sign Language and then you realize you're not sure or it's not clear, then that is okay too. We are all here learning ASL and we know that no one is perfect. So you can use different ways of asking your questions. You can use the chat. It is all okay. The one important thing I will note is that only one person should be speaking at a time. You know, we don't want to have to try and split our eyes and say who's looking where. So it's always best if we only have one person signing at a time, one person speaking at a time. And that's really important for communication, not only for us, but also for the interpreters. So hopefully that's clear for everyone. And at this point, I am going to have our panelists do some introductions. And so what will happen is I will say your name, and then I'll have you introduce yourself by sharing about your identity, deaf, hard of hearing, and then talk about either your field that you're in now or what you're studying. And I'm going to start off with Kenneth DeHaan.
Hello, I'm Kenneth. I'm deaf and I work in the ASL department. I just started in August 2019 and I have a degree in teaching ASL, and that's where I am.
Okay, great. Next up, we will have Sarah Sparks.
I'm Sarah Sparks. I'm deaf. And I'm an audiologist, clinical audiologist, and I work with Speech and Hearing Center. And I also have a private practice online called Audiology Out of the Box.
That is awesome. And our third panelist is Michelle Minshew.
Hi, I'm Michelle. I'm from Texas. I am a deaf person, and right now I am studying human resource development at UT at Tyler, Texas. And yeah, I'm deaf.
Yeah, Texas people represent. Next up, we have James McCann.
I'm Jim McCann, and I'm a faculty member at Gallaudet in the Speech Language Audiology Department as an SLP. I graduated from Gallaudet far in the past from this program, and I have returned, and I joined in August 2018. Prior to returning to Gallaudet, I worked as a speech language pathologist for many years with deaf and hard of hearing children from birth to high school.
Awesome. And then next is my friend Edith Dong.
Hi all, I'm Edith. I identify as a deaf individual. I'm from Delaware, and I'm a second-year audiology student at Gallaudet.
Awesome. So thank you all for coming. So I'm going to just kick it right off and get into the questions. Can you tell us all about your experiences using speech language pathology and audiology services? Whatever people want to share, anything in there.
This is Ken. I guess I can start. I don't mind starting. So again, I was born deaf. And I remember going to the audiologist and going through speech. It was a pretty positive experience. My speech path, I want to say I started that in elementary school. And I had one person, and then in middle school was someone new, and then high school, they reduced the amount of time that I was doing speech therapy. And I want to say my junior and senior year of high school, I stopped. But between those three speech paths, they all were fluent in ASL. And so that made my experience incredibly positive because that's my first language, and so, that really just made everything incredibly positive all the way around. And my audiologists weren't fluent, but was a really, really sweet thing. Was a really sweet person. And the plus to working with him was, even though I was a kid, he'd ask me, he never made decisions for me. He would ask me questions. He would say, well, what do you like and why? And and my mom would interpret that. And I felt empowered in a lot of ways to make decisions for myself.
I guess that I can go next. So I was born deaf in my left ear, but I did have a little bit of hearing loss in my right ear and could still hear some. So I was in an oral program where I was working with a speech therapist and with an audiologist, but they didn't know sign language. They all believed that speaking and listening was really important in life. And I'm trying to think when things changed. It's really honestly a complicated story. But when I got to RIT, I really met people in the deaf community, and that's where I learned to sign, and that's where I learned about audiology, where I learned more about how audiologists can actually support deaf culture and ASL and all of that. But I didn't really learn a lot about it until coming to Gallaudet. Gallaudet is where I learned that you can really be an audiologist and be someone who signs and supports deaf culture. So that's a good summary of my experience.
This is Michelle. I guess I'll go. So I grew up with a lot of speech therapy all the way through elementary school and middle school. It was a pretty good experience. I have a twin brother, and so we went together. And he was hearing, and so I was able to communicate with him. And then when I went to RIT for college, I learned more sign than I had grown up with, because I was the only deaf person in my school, and I didn't have a lot of knowledge or exposure to sign language until college. And then once I got to college, my voice actually, my speaking voice went down because it regressed because I was signing so much. And so again, it wasn't until after college that I really became more aware of what deaf identity could look like, and really didn't focus so much on my speaking. But I went to the audiologist. I had some bad experiences with some audiologists where there was some discrimination and a lot of pressure to get a cochlear implant. And I would tell them, that's my decision, and you can't force me to do what you want to do. And we talk about hearing aids, and it was fine, but that was an impact later.
I can go. So I was born hearing, but then my hearing did change over time when I was a teenager. So I grew up in a really impoverished area where there weren't any audiologists. So I started seeing an audiologist as a teenager. And that experience had both positive and negative components to it. So some positive experiences of the audiology were that they encouraged me to be myself. But then I had other audiologists, which it was more negative because I think they felt that ASL was not as equivalent to spoken language. And so I was able to, I was already fluent in spoken language. And so I think that that's why the audiologist assumed that I wouldn't want to learn ASL. They were basically like, why would you want to learn that?
This is Ken. Could I add just a bit?
Yeah.
I noticed Michelle and Sarah, their comments related to the both positive and negative aspects of their experience. And my personal experience was pretty positive. I do want the audience to know that obviously there are a variety of experiences and backgrounds and folks who worked with people. I mean, my own experience is not reflective of all persons. And so I've heard some horror stories. I've heard lots of negative stories. I've seen some, like myself, where it was a positive experience. I'm grateful for that situation, but I'm unique, and to have 3 speech paths who are all fluent in sign language throughout my life, that I realized that was a unique circumstance.
I guess I can move on to our next question, if that's all right with everyone. Do you think speech language pathologists and audiologists' actions impact the deaf community? And if so, how?
This is Jim. I'd be happy to start on that one. I think it's important that we recognize very often parents who have deaf children, they're the first person to identify, the idea that a baby is deaf. And the first person that they talk to is an audiologist. So those early conversations that the audiologist can have about the child, that they didn't pass the screening or that they need to be referred for further tests. Our word choices are critical about how they understand deafness and language acquisition. And as we talk about their success, what does success look like? We can talk about being successful with, do we only say about spoken language, or do we talk about interactions with the deaf community? SLPs and audiologists need to be careful in the language we use, because that will impact these parents' decisions and actions with their deaf children.
Mm-hmm. Sarah, take it away.
I agree. The language we use is vital. And as audiologists who work with older adults as well, how they think about these babies and children, gives them a very different picture than, and how we interact with them is different than adults. But, how the language that we use with older adults, that's important. But, being an ASL friendly office and understanding that we are all colleagues and how we all work together is important.
This is Kenneth, if I can just add to that point, and some of what Jim was saying, I think it's important for us to truly understand doctors in general, people who have terminal degrees, are often thought of in society as someone who has a level of expertise. Well, they are, we should trust because they've studied this for years. And so whatever they say might not be questioned or challenged. And so the people who are audiologists, who are speech language pathologists, should think long and hard about their framing, the word choice they use, because there is a huge impact there on the way that deaf people are viewed, not only when we're talking about early intervention with babies, but through the lifespan. College professors would be one example, K through 12 teachers, the way these conversations are framed in organizations, in ASHA, in the media, and how all of the ways this frames the perception of deaf people that exists, and that has an impact on deaf people. But, how can they challenge this if they don't know better themselves? So that's an important thing for us to keep in mind. If you want to become an SLP or an audiologist, it's important to think a role that you play and how people will view you as having a level of expertise. And you should think about the words that you use and the way that you frame things, and to always keep that level of power in the back of your mind.
This is Michelle. I'd say, when we talk about having an interpreter in speech or in audiology appointments, to ensure that there's comprehension. If a deaf person wants an interpreter to have a conversation with the audiologist, a lot of times it's disregarded. It's like, we don't need an interpreter. We can get by. And for you to consider as audiologists or SLPs, you need to know why a deaf person is requesting that interpreter. I just recently, I went to my audiologist and they said, well, we don't need interpreters. And I said, well, yes, especially today we're masked and I can't read your lips. So, it's important that we have that. And, all deaf, not every deaf person can read lips. Some can, some can't. It's an art more than a science. And so it's better that we have an interpreter to ensure clear communication and comprehension of all that's being discussed.
Yeah, I'd like to add to that. When interpreters are booked, it's also important that the audiologists are aware that if a deaf person can talk, you still might need an interpreter. Because sometimes I need an interpreter for my medical appointments right now because of the usage of masks. Typically, I use spoken English, but for me to understand what they are saying, I need an interpreter. And so sometimes my doctors will tell me, oh, no, you don't need an interpreter. And so I've had that experience as a patient, and it's just really important that even if someone is speaking, it doesn't mean that they don't need an interpreter.
This is Edith. I don't think I have anything to add. I think everyone said they hit all the points that I would have wanted to make.
Great. So as students, we want to become more deaf positive. So how do you think that we can best accomplish that goal? Is that question clear?
This is Edith. I can start with that. I think there's two different approaches that I could recommend. Spending time with deaf people, going to deaf events, learning more about deaf culture and deaf persons and their beliefs and values. And then additionally, reading books, watching videos and so forth. but honestly, in my opinion, actual real life socialization with deaf people is better and helps you to connect with the deaf community in better ways, and helps you to pick up ASL much more quickly.
This is Kenneth. I have a couple of thoughts on this. I think before you can really do anything to try and improve and connect, you have to start with yourself. And I'm not talking only about SLPs and audiologists, but just hearing people more broadly in general. Really need to have a hard look at yourself. Look at your own beliefs. Think about your biases. What do you think or feel about deaf people? In the back of your mind, you have some hesitancy or some sense that maybe deaf people really should be fixed or be more like hearing people. And so you maybe need to do that work of realizing what biases you have and think about how you can improve on those to get you on the right track to being able to get to a point where you can really connect with deaf people. So I think it's important to always start with that inner reflective work. And then the second thing that I wanted to share has escaped me now. So someone else.
This is Jim. I would just like to add to that. I agree very strongly with Edith, the idea of immersing yourself within the deaf community. But my one piece of advice maybe isn't helpful. Don't just go at random and hang out with any random deaf person. The statement that I use for most students is, to help you become more successful, find, language models aren't going to become your friends. Friends are good to have, and friends can be good language models, but don't just find some random deaf person who can sign. Find those deaf people who you are interested in them personally, through connections, and then explain, I'm interested in acquiring ASL, but if I have nothing in common with that person, if we have no common interests, what are we gonna have to talk about, right? You're not going to be able to pick up the language as readily. So if I don't care about your background or your personal interests, and all I'm doing is, trying to take advantage of using your language, rather than finding a deaf person who's interesting, who I have things in common, who I want to get to know better, I'm going to push myself, and possibly succeed at a greater rate than with any just random deaf person on the street. And Michelle said, I have nothing to add to that.
I really want to remember what my second point was. I feel like it was important. Perhaps if it comes to me, I'll share it later.
This is Mary. That's fine. I do want to say share a quick story. And she's frozen for me.
Frozen for me too. Yep. Mary, you're frozen. You are back.
Yeah. Looking back over the course of your life, do you think your interactions with deaf clients changed or influenced your professional perspective? If so, do you have anything that you'd want to share in that regard?
Yeah. So for me, as a deaf person, there's not only one deaf experience, there are so many experiences that exist out there. Some people are born deaf. Other people grow up at residential schools for the deaf. Some people grow up with a more oral experience. So there's this variety of deaf experience that I think is important. as I develop my professional practice to keep in mind the diversity that exists there.
This is Jim. I don't like the word client, but you mentioned clients, so I'll go ahead and use it. But those babies, the birth to 3, I don't know if we can really call those clients, but yes. So I guess the whole range of them. Before my professional experience, I want to say that my biggest work within the deaf community, I took ASL classes, but before I came to Gallaudet, I hadn't really spent time with the deaf community. And once I came to Gallaudet, I lived on campus. I had a deaf roommate for many years. And I paid attention to what they shared in terms of their life experiences. And their perspective impacted how I began my professional career. And that changed the shape of my journey. And I believe, yes, all my clients have influenced my behavior, because any kind of service or interaction with those folks requires that I not only listen, but I understand the person that I am interacting with. Even 2 or 3-year-olds, they're going to let you know what they want. But, it's not just about the adults are saying, no, this is what we want. So working in concert with the parents and with like schools, and especially once kids are in middle and high school, they need to make their own decisions. They have rights to determine the course of their lives.
Did you have a hand up, Edith? Okay. Yeah, I remember the second thing that I was thinking about, and it actually does tie in on this question too, in terms of what has influenced me and what's really impacted me. I've been teaching for 11 years, and in that span of time, I have worked with a lot of SLPs and a lot of audiologists, also some dental and medical students who want to get into different fields. And I have seen a pattern exist, is that students come into my class always asking certain questions with the reflection of a certain mindset. And that mindset is this need to cure or fix deaf people, to help them somehow fit in with society. And I think the mindset is something that has really struck me in terms of, what do the textbooks they read say? What has informed them? Maybe there's one paragraph about deaf people in all their 4 years of education. And yet they plan to enter this world where they will be working with the people who they have not learned much about. And so it has truly struck me, how can I get them to shift their mindset from this idea that deaf people need to be fixed to deaf people need to be served? These are your clients. Think about serving them in terms of what do they need and not in terms of fixing them, because I think those are 2 really different ways of approaching the situation. And that shift in mindset makes a huge difference.
This is Edith. I would like to add about deaf interactions, with deaf, between deaf persons or even with deaf clients. Hearing folks who are interested in learning sign language or to learn more about deaf culture typically seem to be afraid to approach folks in the deaf community, or they're afraid that they're going to offend deaf people. And I want to really emphasize, don't be scared. If you're curious about something about the deaf community, we're not going to be offended. We love to share things, and to answer your questions. So if you're curious about deaf culture, folks are happy to answer. Do not be afraid. We love to see hearing people learning things about our culture. So I really want to encourage you to get out there and spend time with real life deaf people.
I want to add something to that. I do say I agree that many deaf people are willing to say, yeah, come on. Please do learn about deaf culture, learn about our language. I am a hearing individual, so I don't want to speak for someone who I'm not, but I did have a good friend who really didn't like it when people would come up to him and say, oh, you're deaf. Can we do some ASL together? And he was like, well, just because I am deaf doesn't mean I'm here to teach you ASL. You should figure it out and then come back to me. So I do think, Kenneth has a good point that there is this variety of deaf experiences. And there are lots of deaf people who are more than happy to talk about the deaf experience, their background with language and all of that. But there are other deaf people out there who are going to say, I have my deaf friends. I don't need you to come and learn my language. That's not for me. So again, I don't want to say that that is all deaf people either, but I do think you might run into some deaf people who will have some resistance, and they will have a sense that they don't need you to learn their language because they already have their community. And again, I don't want you to be afraid, but I do want to just emphasize the variety of perspectives that exist out there as something for you to keep in mind.
Mhm. This is Michelle. Just because someone is deaf, that doesn't mean that that's their only disability. They could have multiple disabilities. They could be autistic. They could have other physical disabilities, but some deaf people don't necessarily, like Jim was saying, aren't comfortable with hearing people just approaching them without warning. Perhaps they had anxiety. They have anxiety, or perhaps they had bad experiences in school. And so just be mindful when you approach someone. Like we said, there's a variety of experiences, just same for deaf as hearing people. We all have different life experiences. But that's the idea, that be aware of that when you approach anyone.
Okay. But when deaf events happen, for sure, make the most of those opportunities and do attend.
This is Mary. Kenneth, your experience with those audiologists and SLPs who are willing to sign with you, or that you had positive experiences, how did that affect you growing up? Were they positive, or other folks that signed with you growing up? Can you speak a bit more to that?
So yeah, I can sort of recap that question. My experience with SLPs and audiologists, how did it impact my perception? Is that what you're getting at?
Well, yes, your perception, or just, growing up using sign with those professionals.
I think it was more like what James said, having a lot of people who were willing to engage with me, and there were other people who were more resistant. I was somewhere in the middle. I know that there are a lot of good people out there, a lot of well-intentioned SLPs and audiologists, but at the same time, as an outsider, if you look at it, there's still a lot of ugliness and a lot of pain that's been caused and a lot of oppression by the field that's been done. And so I understand the resistance to the system or organizations as a whole. Now, on an individual level, I understand that there are many great people who are inclusive, respectful, learn to sign. And so in terms of what I can do, I would say, yeah, I always will support people where I can, but I am still carrying resistance to the field myself because I do see both sides of that. Did that answer your question?
Yeah.
If it was off topic, you can let me know that too.
No, it was great.
I won't be offended.
So I don't know how to ask, this is kind of an awkward question, but audiologists and SLPs, as you work with deaf and hard of hearing people, do you use ASL and then working with hearing folks? How do you work with those two different populations? Like, do you understand what I'm asking? I know, again, everyone has different experiences and different goals, but
I just want to clarify the question. Are you talking about working with deaf people and working with hard of hearing people and how we as professionals approach each of those groups differently?
yes, sure.
Well, for me, the labels deaf or hard of hearing are not really important labels. As a speech language pathologist, I would say they're not important labels. We look at what skills people have and we look at the goals that they're working on. We look at what they want to work on, and together we can figure that out. So if you are a deaf person and you identify as deaf, either from a deaf cultural perspective or from an audiological perspective, that is not the most important piece of our work. Does that make sense? Okay. I will say sometimes that there are people in the field who will look at an audiogram and say, well, below this line, you're deaf. So now I'm going to put you in a signing program. And if you are above this line, then I'll put you in an oral program. And that's how we make these decisions. So there are some times that people are misconstruing and misusing audiograms to label people deaf and hard of hearing and make those sorts of decisions based on those sorts of labels. There was one former school program that was a mainstream program that would always say, well, if your audiogram's down here, you're deaf, you should go to sign perm. Oh, your audiogram's up here. Let's call you a hard of hearing person. Let's get you a cochlear implant. Let's place you here. So the audiogram has been used for these purposes. And I really strongly believe that that is not the way we should be using this piece of paper to decide where students should be educated. So we still see that sort of approach in existence today, but that audiogram doesn't have the value that's being ascribed to it. And again, this is my opinion. I'm not speaking for Gallaudet today. I'm not speaking for Asha today. This is me, Jim McCain, giving my own opinion only.
This is Sarah. I would add to that. My perspective is that identity is important and needs to be respected. And at the same time, audiologists don't diagnose identity. We talk about their hearing levels. Identity and hearing ability and hearing levels are very different things. And if someone says that they identify as hard of hearing or that they identify as deaf, I absolutely respect that because their identity is their decision and their understanding. But as an audiologist, what I'm looking at is the audiogram, and that doesn't label someone deaf or hard of hearing per se. We don't label folks because of an audiogram.
I agree with that. Yes. On a personal identity level, those terms are important. I want to echo that. I agree with that statement.
All right. If any of the students, we'd like to open it up to our audience. If anyone has questions, please type them in the chat, or if you'd like to speak it, our interpreter will come on screen, or if you want to pop on screen and sign, we have all of these modalities ready for you to interact with our panel. So bring the questions.
On. We're ready for them.
Come on, don't be afraid. Oh, we have a question in the chat.
Okay. Looks like we have a question from Morgan. It's about how my experience and use of cochlear implants has impacted my practice. That is a great question. Thank you. So I started the AUD program with hearing aids. And then I got a cochlear implant my second year in the program. And then I got my third year, in my third year in the program, I got my other surgery within the AUD program. With that said, I do feel that it has been a benefit to me because when deaf and hard of hearing kids see me wearing implants, they're excited. And I can show them that. I am a successful deaf adult, and you could become an audiologist if you are deaf. That there's not a limitation that exists there. And it also has an impact with parents. I think it's important for the parents to see as well. I have these cochlear implants, and I show them that I can use American Sign Language and spoken English. And so signing wasn't a limitation for me in my life, and that it was an opening of my life, so to speak. And sometimes parents need to see that they can sign with their child, and it's not a bad thing. And it's not going to mean that their life will be limited by the use of ASL. And I also think it's beneficial for me as a deaf audiologist to use my cochlear implants.
Hi, everyone.
2 people.
Yeah, we have a question.
Yeah. What is one thing people can do to make the world more accessible?
To make the world more accessible?
Yeah. What is something that I could change?
Just to clarify, what could you do to make things more accessible in your practice or just in the world in general?
I guess both, maybe. I mean, in the clinic, yes, but also just in my everyday life as well.
Does anyone want to answer that?
Have captions on your TVs. When you're at home or in a restaurant or in a store or an airport, and all of those places. I think that a law was recently passed actually requiring airports to turn the captions on. I don't remember when that happened. But, not all restaurants have their captions on their TVs, but it would be nice if they did. Making a law that would require TVs in restaurants to have the captions turned on would be something that would create greater access.
This is Sarah. I would add deaf and hard of hearing people also need access to communication from us, and hearing people need to make the decisions to be responsible for themselves. Like, for example, speech to text apps. If someone is using it, when you meet up with someone, then use it. It doesn't mean it's always the deaf or hard of hearing person's responsibility alone. The hearing person also needs to take some of that burden to assist with accessibility.
I guess I can add to that. If we're thinking more broadly, more generally here, I'm going to share just my opinion. I don't think the majority of deaf people expect that all hearing people will learn to sign. We understand that you grew up in your culture, you learned English, but the reverse is not true. Often, hearing people say, oh, deaf people really should learn to speak to enter society. And so that double standard exists. So I think it's important, not necessarily that you know ASL, not even that you understand deaf people, but the important thing is that you keep an open mind and an open heart. So when a deaf person shows up, you can think, how can I make this situation accessible? If you don't know how to do it, you can ask them. The best approach is to always ask the individual what they would like in any given situation, what their preference is. And that can help to make that person's environment more accessible. And I think that that same thing applies for SLPs. But if we're speaking more generally, I would keep that statement as it was. But if we're talking about SLPs and audiologists, people working specifically with deaf people, that's a situation where I would really encourage you to at least have some fundamental knowledge of ASL to understand your clients and their culture. So you understand who you're working with, to know how you can better align with their needs. So you need to educate yourself if you are someone in that position. In the University of Pittsburgh, ASL isn't required for those programs. And so someone could graduate without that. And, the question might be, how often did you talk about deaf people or ASL? And they might say, one or two or three classes. But you can take the initiative yourself to think about what your goals are and take the classes or workshops or trainings that you need to be so that you'll be able to interact and talk with deaf people. So I think that's a pretty good balanced global answer. And this is Michelle. I just want to add a bit about interpreters, because I actually recently went to an audiology appointment and the audiologist was like, well, who's going to pay for the interpreter? And I had to explain to them about how the interpreting process works. And so I think it's better if you have that knowledge as well, not only about deaf people, but about the responsibility that companies have to pay for interpreters, to request interpreters. Maybe the deaf person might have a preference for who will be requested to be their interpreter, but the company still has that responsibility to provide one.
This is Jim. I'd add something related to children specifically. In deaf residential schools, the community tends to be signing, primarily, but in mainstream settings, mainstream educational setting, there are people who can sign, but only sign when they're working directly with the deaf child. Like I used to work with an audiologist who, before they'd come into the classroom, that person could sign, but when they get into the room, when they'd be talking to the teacher, even though the child was right there in front of them. And one of our roles, I believe, is that we need to inform all folks who can sign that they do it when they are near deaf and hard of hearing children. Even if you've got a SIMCOM, that's fine. But I think it's important, to make things accessible for children and, to say, oh, well, they can't advocate for themselves. They're only 4 or 5. And they can say, well, if the audiologist, they're not going to say, when you're near me, could you sign for me? No, I think that we as adults must take that responsibility, even if we're not working directly with the child at that moment. If they are present, our kids have a right for that incidental learning moment as well.
Yeah, I'd like to add to that. If you're an audiologist working with deaf and hard of hearing people, they might have their hearing aids off or their cochlear implants off. And if that is the case, you should not be using spoken English with them. It is rude. I have had an experience as a deaf person where I've been working with an audiologist. Well, before I became an audiologist. And I would take my hearing aids off and the audiologist would be speaking to me at the same time my hearing aids were off. And I just felt clueless. I had no idea what they were talking about. And All of your clients deserve to be empowered when they are in your care. So it is important that you not use spoken English when cochlear implants or hearing aids are taken off. You can use a pen and paper and write it out.
Thank you so much.
I see that there's a new question from Austin in our chat here.
This is Kenneth. That's an interesting question. I'm trying to think of what was the last piece of media that gave me any sense of representation or connection. I want to say it was probably back in 1988. There was that movie, Children of a Lesser God.
Yeah, Children of a Lesser God.
Other than that, I'm sure there have been other, but I can't think of.
What about Switched at Birth?
Oh yeah, Switched at Birth. You're right.
That's another one.
Ugh, I didn't watch that show. It wasn't my thing. So that's probably why it didn't come to me.
But yeah, that's the only one I can think of too.
But yeah, I mean, in terms of, from my perspective, I don't think we see that portrayed in the media much at all.
This is Edith. I wanted to respond to Austin's question. And I want to say, I don't think there is enough representation there, because growing up, I thought that all audiologists and speech therapists only focused on listening and speaking skills. I didn't think that they would focus on signing ever. That wasn't something that I knew existed until I was at RIT, and I had heard a few stories from different deaf people about a few audiologists who knew how to sign, or speech therapists who knew how to sign, and it was just not a common narrative. And I remember when I was at RIT, when I was learning about that from these other deaf people, I was trying to look on Google to learn more, just to see what I could find by doing some internet searching about deaf awareness with audiologists or speech therapists. And it was just really hard for me to find anything. I couldn't find, I think maybe I found one article and that was it. And that was when I was like, okay, I'm not sure if I really want to become an audiologist, until I was talking with my mom, who mentioned that Gallaudet had an audiology program, and found that online. And that was where I learned more about how it was possible to be an audiologist at Gallaudet, and how the audiologists learned to sign, and not only audiologists, but SLPs too. And it was just so powerful and amazing when I learned that. And so I think when we're talking about representations in the media, that is something that needs to be worked on. But I also think we as audiologists, as speech language pathologists, have to spread the word, publish about deaf awareness, about how not all audiologists and speech therapists are only always focusing on speaking and hearing, that's not all of it. And so I think the problem is that there is this broad belief out there, and so we need to do our part to spread the word.
This is Kenneth. I don't think there's any right or wrong to this concept, but I struggle with the idea of how do we bring SLPs and deaf persons together to represent in media, like in terms of how we frame that relationship. Because honestly, what we see thus far has not been that great. But I think what's at play are power dynamics, right? And unfortunately, there's a lot of this savior complex, this idea of these poor deaf people and how we need to fix them, this paternal and paternalistic mindset towards fixing and helping poor deaf people. And we really need to move past that and begin to reframe it. And I really struggle with how that could be done, because, where we have deaf people who go to SLPs, there's this idea of they need to be fixed. So personally, I mean, I feel like you've got these clients that deserve equitable treatment. That's something that, I would envision that would be really different and helpful.
I can add to that. I think when we think about this framing of wanting to fix people, my cochlear implants weren't fixing me because I'm not broken, but they are giving me an opportunity to communicate in a variety of ways. So cochlear implants for me aren't about fixing a broken person. They're about a goal of communication. And so if you're using spoken language for that person and that's part of their communication goals, cochlear implant might be important for that person, so that communication can happen in a variety of ways. So cochlear implants don't need to always be seen as trying to fix people. They can be framed in a different way.
I see Chloe's question in the chat.
I think this is a good question. I don't know if other people have thoughts about it. Who should we shine the spotlight on, so to speak? I mean, I think what Jim mentioned earlier in today's panel, you do need to do some of the work yourself. You need to learn and not just expect that a deaf person will be responsible to teach you everything. You shouldn't be putting this burden on them. They shouldn't have to need to explain their oppression or go through the trauma of that. So, you should do some of the legwork yourself. And as you're learning, look for actual friends, deaf people who have similar interests, who could be your friends, and make those connections. And then share what you've been learning about yourself. Does this seem right? Does that ring true for you? And then, ASL classes are another easy way. You're going to have a deaf teacher there who, of course, is going to be willing to open up and share more. There are also deaf culture classes. That's a third thing. I mean, the fourth thing would be to go to Gallaudet University or RIT or CSUN. I think those are a few ways that would be a good way to get you started. Oh, I want to add actually just one more thing. A good rule of thumb is don't think about deaf people the way you would think about like a deer. Like think about them the way you would think of someone from France or Spain or Germany. How would you approach them? What would you ask them? Because that's a parallel situation. You're talking to a person who is a minority with their own language and their own culture. So think about what approach would make sense for someone from a different culture who spoke a different language.
Hi, I have a question.
Okay, Emily.
I have a question, but I'm going to speak if an interpreter.
I'm here.
So my question is about the dynamics between deaf kids and hearing parents, and I'm interested in both the professional view and the personal view. I'm at a pediatric placement. Also, I'm an audiology student. And I've witnessed a few times kind of a tough dynamic between deaf kids who maybe like are too young to feel any sort of like shame or embarrassment for being different, and like want like bright blue, ear molds, or bright pink, or something really fun, and they're super excited, and the parents are just like, no, 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 like skin color, like, just kind of really, hurts my heart, but just kind of talking down to the kids about their hearing loss or deafness. And it's been really hard just to be a student and like watch some of the audiologists deal with that in ways that I hope I don't. And then also just like some that I think handle it really well. And even one mom went as far to say like she doesn't even want like her school to know, or her kid's school to know about her kid's hearing loss. And I was just like really, hurting for that kid. And I'm just curious, to our AUD and SLP, like how do you handle that professionally when it's like the child is your patient, but the parent is really, maybe has some super negative attitudes, and that could be really harmful for that child's social and emotional growth. But then also like, to our deaf panelists, like what do you like, as far as parents, if you're willing to share, like what was that dynamic with your parents? Are your parents hearing deaf, and was there any kind of, I don't know how to describe that negative emotion, but what was that like for you?
I can start. So as an audiologist working with children, parents, adults, all of that, I think it's really tough sometimes to have those conversations with parents about ear mold colors and those sorts of things related to hearing aids. It can become really obvious how much parents really don't want their child to be deaf or hard of hearing, because they are afraid of the way the world will see their child in a negative light. So sometimes I try to make it a point to communicate to the parents a few things. I speak to my own experience about colorful ear modes, colorful cochlear implants, and to recognize it's okay to feel afraid, and I validate those feelings that they're having. And at the same time, I try to show them a different perspective. Being deaf and hard of hearing doesn't have to be a negative thing. There are other minority communities and they might have tough experiences growing up as kids, but they can develop their identity too. And those colorful ear molds or colorful hearing aids can be a way that can actually help to support that child in developing a level of responsibility for those devices, whatever they may be. So my thought is that, it's not always the right time to have that conversation at their appointment, but you can continue working with them as a family in the appointment. And maybe you can show them a different perspective while also validating the feelings of fear that they might have. You can also frame the world in a different way to them.
It's a tough question, I have to be honest, because there's so many factors at play there. I think it's worth trying to frame out your personal feelings versus the professional part. You have to deal with, your fear, your concern, and that might be true. It might be a misconception, so in terms of how you're wanting to respond, objectively. I think it's okay to disagree with those parents, but you don't want to bring bias to the table, because the parents are the ones who have the power in that area, and you need to separate your emotions from your logical professional points and be able to frame that out, and then be able to communicate that to the parents in an open dialogue, which may then open the door to more constructive conversation further down the line.
This is Edith. I have something that I can add too. I really agree with what both Sarah and Kenneth have shared, that it's really important to teach parents of different perspectives that exist and all of that. And I can just speak a bit from my personal experience. I grew up in the hearing world. But also with other deaf people who only spoke and didn't sign. But when I was a kid and I would go to these audiology appointments, every time I had to pick a color, I wanted to pick like pink or blue or whatever, and I couldn't, because my mom always wanted something that wouldn't stand out. So my mom basically wanted me to hide my implant, hide my hearing aid. And so my whole life, I was basically hiding my hearing loss. And it is kind of negative. It did have a negative effect on me, because I felt like I didn't have this sense of pride in who I was and my identity. And that's something really important. I think it's important for people to hear that story, because these experiences will impact deaf children, and they are really important. Parents need to be taught that. I'm trying to think of the best way to explain this. But it's important to explain to parents that to be proud of their kids' deafness and to not try and change or hide that is a way of teaching their child to be proud of themselves. Because for me, it wasn't until I got to RIT that I met other members of the deaf community that I really had a sense of what it was to be proud of being deaf. And I saw that that was something that was missing in my life up until that point. And I wish that hearing parents were taught that more, so that I could have had that sense of self-esteem earlier in life.
This is Kenneth, and I do want to just share a brief story that this is kind of brought back to my mind. My mom was always very anxious and concerned about, anything, in terms of perception, the world's perception of me as deaf. She wanted me to be seen as normal, that I could speak and hear normally, that was a big thing for her. And I remember, one of the doctors asked, why are you so resistant? Why are you so concerned about that? And she said, well, I don't want him to attract that negative attention. I don't want him to be bullied. I don't want folks to think less of him. And the audiologist said, okay, well, so the real problem isn't with your child. The concern is those around your child. And that made my mother stop and think. Said, my child is not the problem. I don't need to try to fix my child. Shouldn't try to make my child look quote unquote normal to match the rest of the world. And that helped her to become more involved in the school system and to establish ASL classes and after school programs for signing and, playing with their children. And what a profound effect on the children that grew up in that school. I mean, I was this popular deaf kid in high school, everybody, I had all these hearing friends that could sign pretty well. And that empowered her to help me, to look differently, and also helped her to examine the root of her fear. And it's not about your child being deaf, it's those around your child. So if it's not your child, then work to change the system. And so try to spend some time, analyzing the root cause of these parents' distress and help them to identify their deaf child is not the concern. And parents are under stress. Society, there's a lot of systems set up, against us. So be mindful as SLPs and audiologists, it isn't just providing results. Your role is to educate these parents as well.
Hi, I'd like to ask a question. So I'd love to pick everyone's brains about working with adults who are either late deafened or who lose their hearing later in life. And just some of the people who I've come across as an audiology student working in our clinic do feel the loss of that a lot and don't know how to go about establishing good communication with their families again, or advocating for themselves in their places of work. Or one person I can think of in particular lives at a nursing home, and it was talking with her about her experience of like going into the dining room and eating and just having such difficulty understanding those around her, and not having access to that communication. I would just love to hear your perspective on tips for teaching self-advocacy and in regards to communication, and also for accessibility needs.
Yeah, I can start with that one. Because I was born hearing, so I did become deaf later in life, which is a similar experience to the one that I had. And it is really important to validate the feelings that people are experiencing. It's okay to feel sad. It's good to tell them you can feel that loss. I tell my patients that they are allowed to feel whatever they are feeling. And at the same time, I will inform them that life goes on after being deaf. Life continues. So people are able to develop an additional identity. And it can become peaceful eventually with what they experience. But it is a journey, and it is a slow process that goes step by step, and each individual is different. I also teach self-advocacy skills. I think it's important to meet a person where they are.
This is Kenneth. I don't have a solution, but a suggestion for something that might help is the principle of universal design, where buildings and structures are in place. They're thought out with the idea of different abilities. So everything is considered. Is this door wide enough? Can every person turn this door handle? So, we understand that everyone in the world are not white, able-bodied persons that can hear and so forth. So how do we begin to construct the world around us to make it more accessible? So if we can be proactive at the outset, so that when people do become late deafened, those resources are already in place. Captions are already on the TV. There's visual access and enough light for them to see, rather than reactive being, when somebody shows up and they have a need, and the scramble to make things accessible. So I think, trying to be as proactive as we can, and universal design is one thing that we can use to be proactive.
This is Jim. I want to make sure I'm not interrupting, that you had completed your thought.
I'm good. All you.
Okay. I also think it's important for us to consider who we're talking about as a group. Are we talking about people who are much older, who are never really going to become part of the deaf community? Or are we talking about someone who becomes deaf and then realizes, I want to learn ASL and I want to be a part of that? Because a lot of people already have their friends, their family, their work, and whatnot. They have an identity as a hearing person. If we're talking about much later in life, maybe 40s, 50s and up, having that hearing change. And so that group of people, oh gosh, I don't want to say require a lot, but they're going to need some support to how they're feeling and how they might respond to hearing loss. During the fall, I teach a class and we use half the semester focusing on those people who really have hearing loss much later in life, and how we, speech language pathologists and audiologists, can support them, and how we can use hearing technology, as well as how we can use counseling and communication strategies to give them the support that they need to make sure that they have a better quality of life at that point. And I'm not trying to imply that having hearing loss means a lower quality of life, but when we're talking about people who have been hearing and using spoken English for decades, this experience of losing their hearing can have a big impact on their friendships, their family relationships, staying connected and immersed in that community that they already have developed. And that can be a challenge for many of them. And I think typically SLPs will provide more ongoing support, whereas audiologists are involved for a shorter period of time, figuring out how to set up a hearing aid orientation or a cochlear implant orientation or some sort of technology. But who's more involved in the long term are the SLPs. Does that make sense? Was that clear? As we're talking about different groups, I think it's good to call that out.
And this is Sarah. I think it's important not to assume, that how a person is approaching their hearing loss, what their perspective is. It may not include the deaf community, or maybe they do want to learn ASL. Like in my case, I was young when I began to lose my hearing. And, maybe for older adults, that may be one approach, or it may not be. You just can't assume ever, because that's why it's worth asking questions, because you won't know until you get the different perspectives of all of these different individuals.
Yes, I completely concur. I agree. There's so much diversity out there.
Okay.
Another question? Did I answer your question rather? Kate?
Yes, this has all been helpful. So just thinking about, again, actually, now that I think about it, follow-up question. If someone was, even in their 40s or 50s, but I guess what would I look for if I was to start talking about, would you be interested in getting connected with the deaf community? Are you interested in learning about sign language? How do you go about introducing those questions?
All right, I just want to clarify, are you talking about for adults here?
Yes, sorry.
What I would do is give them a list of resources, and that list of resources would include options like ASL and cued speech. because you want to give adults all of their options, just like we give children all of their options.
This is Kenneth. I don't know how it would work, but in the future, if you were in private practice, or I guess any hospital or clinic, it would really be a great idea if you had a deaf employee, a deaf audiologist, who was able to be a role model, so that a client who comes in could see, oh, look, here's a deaf professional working in the workplace, and they're able to serve as a role model that could really be a benefit to your organization. So being mindful of having those folks that you can, like Sarah, that you can introduce them to.
And I don't think it's an awkward conversation. It's just a presentation of an option. Hey, here are some different opportunities that exist.
Yeah. And if you tell them and they aren't interested, that's fine. It's that they aren't going to be offended by it. You just are presenting information.
Mm-hmm.
Thank you all so much.
My name is Kate. I am an audiologist. I am a Gallaudet alum, 2013, I believe. And I'd also make a plug for some of the resources that are out in the community. ALDA, HLAA, just other, getting experiences from other people who have maybe been through that type of experience and transition. And, can also speak to what might be available to help other individuals, like in that specific, like late deafened adult experience. That could be helpful. But as everyone has mentioned, there needs to be mentorship, like peer mentorship. We know how valuable, I work at a pediatric facility, how valuable it is for deaf kids to have access to a fluent signer as early as possible. And that may not be their birth parent, but I think a peer mentorship approach in every stage of life is so valuable for folks who have hearing differences. So I am late to join, but I want to commend all of you for hosting this and participating in this, because it's so incredibly valuable as a professional to continue to learn. So thank you so much. I hope I can get access to the recording for what I missed earlier. I'll reach out to some folks here and see if that's permissible. So thank you. I really, really appreciate it.
Yeah, I just want to add to that briefly.
Hi, Kate.
There are different organizations that you could recommend for adults. One is the Association of Late Deafened Adults, ALDA, along with HLAA that Kate mentioned. And then a third one would be local deaf and hard of hearing community centers. Like Northern Virginia has NVRC, Northern Virginia Resource Center for deaf and hard of hearing is, I believe, what the name of it is. But anyway, that there are these local community centers that exist. And so you can recommend those for adults as well.
This is Kenneth. Also wanted to mention, a few of you were mentioning resources, and it came to mind, resources are important, but the issue with resources oftentimes is that professionals will say, I'm neutral. It's up to the parents, I'm just providing you these resources. That's it. And I don't know that needing to be neutral is that important, because parents need to know one way or the other. There are more quote unquote hearing-based focused organizations versus more deaf-based. And so I think going into a bit of detail about what each of these organizations and associations, their focus is beneficial as well. I think it's good to paint the full picture.
Great. Anyone want to have another comment on that? Okay, well, again, this is not the only panel that we will host. We are hoping that we will set up another panel with more professionals. The SAA will not have this be our last panel, but thank you so much for sharing all of your thoughts today. If people want to turn their video on just to say, a thank you, we can do that really quickly. But again, I just want to say big thank yous to everyone.
Thank you so much.
And I see all our students here. Thank you for your time. Thank you for your thoughts.
Thank you.
Big round of applause.
Thank you. Well done. Kudos to everyone. Thank you. Thanks for hosting this.
All right. Have a good night.
Have a good night. Bye-bye.
Bye.